Good evening, ladies and gentlemen, and welcome to News Channel 8, Tampa Bay's #1 source for all of your up-to-date local stories. My name is Jennifer Delgado, and tonight's breaking news story comes to us from Pasco Hernando Memorial Hospital, where a tragic medication error has led to the death of a local Navy veteran. Joining us this evening is Ms. Alexia Garcia, a Florida State Board of Nursing representative, to discuss the standards and protocols for safe medication administration and the risk reduction strategies used in the hospital setting. Welcome, Alexia, and thank you for joining us this evening.
Good evening. Thank you for having me.
So help us to understand what happened here. Let's start with what constitutes a medical error.
According to the National Coordinating Council for Medication Error Reporting and Prevention, a medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in control of the healthcare professional.
So with that being said, what safety checks, or in other words, rights to medication administration, are in place?
Nurses utilize the 10 rights to ensure patients are educated about their medications and receive them safely. The 10 rights for patients are as follows: medication, dose, route, time, documentation, education, assessment, for the right reason, with a right to refuse, and an evaluation. This allows nurses to have a checklist to follow to make sure there are no medication errors.
So according to the Florida State Board of Nursing, who does that hold responsible for safe medication administration?
Nurses hold the primary responsibility for safe medication administration. They use their sound clinical judgment, knowledge of the patient's condition, and knowledge of medication pathways to provide crucial safety before, during, and after giving any medication to a patient. Nurses also provide education and teaching to the patient about the medication they receive, including what it's for, how it works, and any side effects the patient may experience.
How do the aforementioned rights pertain to the roles of a nurse in the prevention of medication errors?
Nurses play the most vital role in preventing medication errors. They are the last safety check prior to any patient receiving medication, and they must adhere to the 10 rights of medication administration at minimum. While these rights provide a crucial checklist to follow, nurses must also ensure they are well rested, not interrupted during medication preparation and administration, and are using up-to-date resources for drug information. Nurses must follow strict protocols involving a witness to watch and document that any high-risk or uncontrolled medication is properly handled and wasted to prevent human error. In addition to working with the pharmacy and the provider to ensure any discrepancies or questions are addressed prior to giving any medication to their patient. Providing proper education is also vital so that the patient is fully aware as to what they are taking and all of their questions are answered.
Thank you for clarifying that for us. Can you now educate us on what are some potential risks of medication errors and what we can be vigilant about as patients in a hospital setting?
While there are many risks associated with medication errors, the most serious are severe harm, disability, and death. Hospitals take these risks into consideration each and every time a medication is administered to avoid causing any pain or harm to any patients.
That can be terrifying as a patient or as a visiting family member. To make the patient experience less nerve-wracking and more healing, what are some ways Pasco Hernando Memorial and all other Florida hospitals are implementing medication error risk reduction strategies?
There are many risk reduction strategies implemented in healthcare across the board. Some strategies include the 10 rights, a well-rested supported staff, 0 interruptions during medication administration, witness and documentation protocols, and up-to-date nursing education. I'd also like to take a moment to say that the State Board of Nursing emphasizes a just culture within all Florida state public and private facilities. A strict no retaliation policy has been implemented across the board to ensure that nurses do not feel pressured to withhold any information regarding what we call a near miss or a mistake in the hospital setting. Protocols and statewide teachings are in place to create an environment where nurses are supported, heard, and are able to report errors or adverse events without fear of retribution.
Alexia, we thank you so much for taking the time to speak with us this evening and shedding light on this topic, and for your thoughtful insight on the policies and procedures designed to keep patients as safe as possible. Stay tuned, because after the break, we'll be hearing from Pasco Hernando's Chief Nursing Officer. You won't want to miss it. We'll be right back. Welcome back. Now joining us this evening is the Chief Nursing Officer from Pasco Hernando Memorial, Mrs. Rachel Johnson. Thank you for taking the time to speak with us this evening, Rachel.
Good evening. Thank you for having me.
Such a sad, sad event in this case where Mr. John LaChance, a former Navy officer, has tragically passed away from a medication error following what should have been a simple surgery. Please start by explaining to us how this medication error occurred in the first place and the chain of events leading up to Mr. LaChance's death.
It started with Mr. LaChance having a history of sleep apnea, and his wife did make the nurse and the physician aware. After his surgery, Mr. LaChance's pain was managed with morphine, which is an opioid known to cause respiratory depression. He was experiencing nausea and vomiting, which are common adverse effects of morphine, so the plan was to take him off of the pain medication and to start him on Dilaudid instead, which is also an opioid. Mr. LaChance should have been assessed by the nurse after the morphine pump was discontinued and prior to administering the Dilaudid. This would have given the nurse real-time vital signs, including his oxygen saturations and respiratory status. Taking his sleep apnea into consideration, our nurse should have been on high alert for potential respiratory depression. His decreased respiratory status went unknown due to the lack of monitoring and unfortunately did result in Mr. LaChance's death.
You mentioned the side effects of opioids that the nurse should have taken into consideration, in this case, morphine and Dilaudid. Can you please tell us what those medications are used for and other harmful side effects, if any, which can come from those medications?
As we previously discussed, the two medications involved in this case are opioids, which are commonly used for pain management. They are known to cause respiratory depression, which is why vital signs and respiratory status should be continuously monitored in patients receiving them, especially those with current respiratory disorders like Mr. LaChance's sleep apnea. In this case, harm was done to the patient due to not only the lack of monitoring, but his current respiratory disorder, which should have been highly documented and considered. Here at PHSC Memorial Hospital, we do our best to create an individualized plan of care for each patient, and unfortunately, this was overlooked, resulting in this tragic event.
How then could the nurse have ensured Mr. LaChance's safety before and or after the medication error occurred?
As previously discussed, continued monitoring of his vitals so that the nurse had a real-time understanding of his oxygen levels, respiratory rate, and level of sedation.
Out of the multiple things that went wrong in this situation, the official report from Pasco Hernando Memorial states that it was in fact classified as a medication error. Can you please explain that to us?
Yes, this medication pass was classified as an error due to the poor patient outcome. This error led to a patient's death and could have been avoided. Therefore, we look at this event as an error, a tragic loss, and a chance for remediation in the future while respecting and honoring Mr. LaChance's life.
So, as you just mentioned, in the future, what is the hospital's procedure now when the medication errors occur?
At PHSC Memorial Hospital, patient safety is our #1 priority. If a medication error occurs, the patient should be assessed immediately to ensure their safety. Our next step is to notify the physician to make them aware of the situation and to request additional orders to maintain our patient's safety, followed by an incident report that is always completed for any medication error, even for near misses, regardless of if harm occurred. Our incident reports are then reviewed by our risk management team to identify what went wrong and how we can improve our policies to decrease the risk of errors here at the hospital. We refer to this as a root cause analysis, and it helps avoid further shortcomings.
At this point, we've had a chance to speak to the Florida State Board of Nursing, who I'm sure you've been in contact with quite frequently, and you explained to us the chain of events leading up to the untimely passing of Mr. LaChance. What does the future hold now for this nurse, and how has the atmosphere changed at the hospital regarding the rest of the nursing staff?
Of course, the nurse is responsible for performing frequent assessments and monitoring the patient to ensure their safety, as that is our #1 priority. When a patient has a history of medical conditions that could potentially worsen with certain medications, such as opioids in this case, it should be brought to the physician's attention immediately so that an alternative plan of care could be implemented to provide the best outcome for the patient. When working with the Florida State Board of Nursing, as discussed by Ms. Garcia, we do promote a just culture here at Pasco Hernando Memorial Hospital. The primary nurse has expressed intense remorse and has willingly agreed to further education and training regarding opioids and their adverse effects. We again want to reiterate that even though this is a tragic event, we still need our nurses to feel supported, heard, and work without fear of retribution so that not only here, but in every healthcare setting, medical professionals can continuously grow and improve.
Thank you, Rachel, for joining us this evening. The silver lining here is that even in Mr. LaChance's passing, he's continued to help guide others, in this case through a medication error that will bring about positive change in our Florida healthcare systems. Coming up next, Florida man arrested after attaching 300 balloons to a lawn chair, stating he wanted to save gas on a trip to Key Largo. Stay tuned. We'll be right back.